So for our topic, it's all about assessment of a high-risk pregnancy. So high-risk pregnancy is when a woman enters pregnancy with a chronic condition such as cardiovascular or kidney disease, or both she and the fetus can be at risk for complications because either the pregnancy can be complicate the disease, or the disease can complicate the pregnancy, affecting the baby or leaving a woman less equipped to function in the future or undergo future pregnancy. So for the definition of high risk, so high risk is one of which a concurrent disorder or pregnancy-related complications or external factors jeopardize the health of the woman, the fetus, or both. And one in which some condition puts the mother, the developing fetus, or both at high risk than normal risk for complications during or after the pregnancy and birth. And here are the causes for a woman at high risk. It can be related to pregnancy itself or when they exist in pregnancy. So also it can occur because the woman has a medical condition, or can result for environmental hazard, and can arise from maternal behavior or lifestyle, and also causes poverty, lack of support people, poor coping mechanism, genetic inheritance, past history of pregnancy complications. These are circumstances and causes for a woman to be at high risk.
Demographic factors. First off, we have maternal age. Pregnant woman ages less than 18 and more than 35 years of age. Adolescents or pregnant women under 18 may not be fully physically developed yet, making pregnancy riskier for both the mother and child. Underdeveloped bodies of adolescents can lead to increased risk of low birth weight and preterm labor. Also, adolescents under 18 may experience hormonal imbalances that contribute to conditions like pregnancy-induced hypertension and anemia. Moreover, adolescents under 18 may have incomplete pelvic development that may contribute to complications such as cesarean section or cephalopelvic disproportion. Women over 35 have a higher risk of pregnancy complications due to several factors related to aging. As women age, their fertility decreases and the quality of their egg declines, leading to an increased risk for chromosomal abnormalities in babies like Down syndrome. Other risks for pregnant women over 35 include the higher likelihood of developing gestational diabetes, pregnancy-induced hypertension, preeclampsia, placenta previa, hereditary deformed mole, and low birth weight babies. Next factor, we have poverty. Poverty or low income limits access to health necessities like adequate nutrition, impacting maternal nutrition intake and leading to lower birth weights, low fetal growth rates, and increase the risk for preterm delivery. Next, we have multiparity or more than 4 pregnancies. After multiple pregnancies, the uterine muscles may not contract as effectively. There's an increased likelihood of placental abnormalities such as placenta previa, which can contribute to hemorrhage and necessitate a cesarean section delivery. Personal social factors. First is weight. Pregnant women weighing less than 100 pounds may be at risk of giving birth to infants with low birth weight. Excessive weight, particularly over 200 pounds, is associated with pregnancy-induced hypertension and can contribute to large for gestational age infants. Additionally, excessive weight can make labor challenging due to factors of cephalopelvic disproportion, which leads to cesarean section. Next, we have height. Height of less than 5 feet is associated with an increased risk of cesarean section due to cephalopelvic disproportion. Next factor, we have smoking. Maternal smoking during pregnancy is linked with higher risk of preterm births, low birth weights, and birth defects such as cleft lip due to exposure of the fetus to harmful chemicals in tobacco. Next, we have alcohol. Alcohol during pregnancy can cause miscarriage, stillbirth, and range of lifelong birth defects known as fetal alcohol spectrum disorders. Substance abuses, including illegal drug use, can lead to poor fetal growth, preterm birth, specific birth defects, and neonatal withdrawal syndromes. Opioids, for example, are linked to neonatal opioid withdrawal syndrome.
Let's proceed to obstetric factors and gynecologic history. If birth of previous infant with weight of above 8.5 pounds or 2 or more premature deliveries or abortions, the mother is in risk of cesarean, birth injury, maternal gestational diabetes, and neonatal hypoglycemia. If there is previous stillbirth and RH sensitization, it may increase risk of maternal psychological distress. Cervical insufficiency or cervical incompetency may increase risk for fetal anemia, erythroblastosis, and kernicterus. Multiple gestations or pregnancies malposition and malpresentation may have effects associated with delivery of previable fetus. If the mother had previous dystocia and placental abnormalities, there will be effects associated with nutritional anemia, preeclampsia, preterm labor, malpresentation, cesarean, as well as postpartum hemorrhage. For the existing medical conditions or maternal medical history, first we have diabetes mellitus, which increased risk of pregnancy-induced hypertension, cesarean, large for gestational age, small for gestational age, neonatal hypoglycemia, fetal death, and congenital anomalies. Hypothyroidism may increase risk of spontaneous abortion, congenital anomalies, and congenital hypothyroidism. Cardiac disease may also increase risk of neonatal death, so watch out for signs of worsening heart disease such as edema, crackles, activity intolerance, and irregular heart rate. Renal disease may increase risk associated with maternal renal failure, preterm delivery, and intrauterine growth retardation. Concurrent infection may increase severe fetal effects if maternal disease occurs in the first trimester, which increased risk for spontaneous abortion and congenital anomalies. Seizure disorders increase risk for fetal malformation, increased incidence of cerebral palsy, seizure disorder, and mental retardation in offspring. Lastly, liver disease, which increased risk for preterm and stillbirths.
So here are the vulnerable groups of pregnant women. First is adolescents. So they face a higher risk of eclampsia, endometritis, and systemic infections. And babies of adolescent mothers faces a higher risk of low birth weight, preterm birth, and severe neonatal condition. So mentally ill women. Suicide is an important cause of death among pregnant and postpartum women. Another is psychosis, which is much less common but can also lead to suicide and even harming the newborn. As well as depression, which causes enormous suffering and disability, which reduces response to child's needs. Another is women over the age of 40. So a pregnancy after 40 years old is worth considering as a risk. They have significantly higher risk of cesarean delivery, preterm, preeclampsia, gestational diabetes, and fetal death in utero. Another is women who is a substance abuser. So pregnant women who are illicit drug users during pregnancy may cause miscarriage, preterm labor, birth defects, stillbirth, withdrawal symptoms in the baby after birth, a higher risk of sudden infant death syndrome, poor fetal growth rate, and behavioral problems. So next are the danger signs during pregnancy or with pregnancy. So first is pain. Pain is an early warning sign by the body that something serious or dangerous may be happening. So the placenta abruptio, premature contractions or labor, and severe hypertension are some of the causes of pain in the third trimester. Another is persistent vomiting. So hyperemesis gravidarum or persistent vomiting can lead to dehydration, fatigue, and can also harm the baby and may lead the baby to be born small and early, and they may have a higher risk for stillbirth. So another danger sign is sudden gush of fluid from the vagina. So if water breaks too soon, it may lead to premature birth. Another is headache. So this is a sign or a symptom of preeclampsia which can lead to serious complications if it is not monitored and treated. Another is bleeding, so vaginal bleeding. A pregnant woman should see a doctor immediately if she has a rapid heart rate, pains, and with accompanied bleeding from the vagina, for it may be a sign for miscarriage. Another is blurred vision. So this is a danger sign associated with gestational diabetes and high blood pressure and preeclampsia.
Factors that categorizes client to be high risk. First to be tackled is the pre-pregnancy. Psychological, history of drug dependence including alcohol, history of intimate partner abuse, history of mental illness, history of poor coping mechanism, survivor of childhood abuse. Next is the social, occupation including handling of toxic substances, isolated, lower economic level, poor access to transportation for care, poor housing, lack of support of people. Physical, visual or hearing challenges, pelvic inadequacy or misshape, secondary major illness like heart disease, diabetes mellitus, kidney disease, and hypertension. Next is the pregnancy. Psychological, loss of support person, illness of a family member, decrease in self-esteem, drug abuse including alcohol and cigarette, social, refusal of or neglected prenatal care, exposure to environmental teratogens, disruptive family incident, physical, intake of teratogens such as drug, gestational diabetes, nutritional deficiency of iron, folic acid or protein, poor weight gain, pregnancy-induced hypertension.
During labor and delivery, individuals may face several challenges, including the psychological. First is the severely frightened by labor and birth experience, inability to participate because of anesthesia, separation of infant at birth, lack of separation for labor birth of infant who is disappointing in some way, such as sex, appearance, or congenital anomalies, illness, and newborn. Next is the social, which include the lack of support person, inadequate home for infant care, unplanned cesarean birth, lack of access to continued health care, lack of access to emergency personnel or equipment. Lastly, the physical challenges, which includes the hemorrhage, infection, fluid and electrolyte imbalance,